When the COVID-19 outbreak began, the virus hit black and brown communities so hard with nearly unspeakable losses. Since April, the Michigan Coronavirus Task Force on Racial Disparities has been working to eliminate that impact that it's had on communities of color.
They've made progress by making testing more accessible for communities of color, which includes drive-through, walk-up, and mobile testing sites. They've helped people find primary care physicians, handed out millions of masks, and reminded people to wear them through aggressive marketing. And they've also recommended implicit bias training be a requirement for all medical professionals. The data showed early on it was working. But now that cases are going up, will this be enough? I asked that question to Lieutenant Governor Garland Gilchrist, who heads the task force.
So do you think the recommendations that the task force has made will help black and brown people fight off a possible second wave of infections?
I think the recommendations that we've made will continue to need to be implemented as they have been as the seasons change. We recognize that we still don't have an antiviral treatment. We still don't have a vaccine. So that means we all still need to be vigilant and be careful. What we have seen is that as these numbers have begun to inch upward in Michigan, the disparities have not returned, but we cannot rest on our laurels.
We've done news stories where people have said the hospitals or doctors sent my loved one home to die in their recliner because of implicit bias. Have there been conversations amongst the task force in terms of how we combat implicit bias and put an end to it?
And because we didn't have enough tests, we literally didn't have enough tests. So medical professionals were put in this impossible situation where they had to choose who got tested and who did not. And when you have a choice point like that, implicit bias can impact how you make that choice. And so one of the first actions that the task force took was through Dr. Khaldun writing a letter to every medical professional in the state of Michigan, naming that implicit bias may be present in testing and treatment decisions when it comes to COVID-19. And letting them know that the research to deal with implicit bias, like step one is naming that implicit bias may be present. And then that is how you begin the road to deal with it. We've actually gone much further with that, again, showing some leadership here around the country and doing two additional things. One is we have, through executive directive, called for every state employee in Michigan to undergo implicit bias training, including me, including the governor. I took it. It was actually quite eye-opening. And the second piece is that we have begun the rulemaking process to make, as part of the requirements for obtaining a medical license or renewing a medical professional license, that medical professionals would have to have implicit bias training.
For Lieutenant Governor Gilchrist, work on this task force is personal. He's lost 23 people to COVID-19.
For me, I tried to find my way as a public servant to, one, be empathetic, because I'm not the only person, obviously, who has lost people to this virus, and to try to channel that as motivation to make sure that we can lose fewer people going forward.
One more thing I want to mention, the task force recommended the governor declare racism a public health crisis in the state. And Gilchrist says what that did was give every state department permission to revisit their policies and their impact. He says because once you can name something and quantify it, then the conversation can be had about what reform looks like.